This is episode 32 of the Fat Doctor podcast, and today we're going to be talking about Rowan. It's Rowan's turn. Last week we did Jamie's story, and as you hopefully, if you didn't catch this last week, Jamie was a fictional character. I used gender neutral name and gender neutral pronouns just so that anybody could listen in and go, hey, I can relate to that. And today I'm going to talk about Rowan. I tell you what, if nothing else, I think I said this last week, I did like a sort of list of gender neutral names, and if nothing else, I'm going to be officially legally changing my name to Asha soon. I haven't done that up until now because, quite frankly, I had several years left on my passport and I didn't want to spend the whatever it was, 75 quid to get my passport renewed, which now that I think about it is quite ridiculous. I think also I just didn't want the faff. It's going to be a lot of hassle changing my name. But anyway, as I get ready to change my name, I'm thinking, do I give myself a middle name? And if I'm giving myself a middle name, I have quite a long list as I wrote down all the different gender neutral names for my fictional characters. Rowan's a good one. I like Rowan. So Rowan is the star of today's show. And Rowan came to see me. Remember, fictional character, folks. Fictional character based on a sort of amalgamation of different people that I've come across whilst I was working as a GP and now working as the Fat Doctor. So Rowan came to see me with a history of poorly controlled diabetes. This is very common. I see a lot of diabetics. That's partly because I am diabetic and people think I can relate to them, and then I'm not going to judge them because I'm in the same boat as them. And also because, let's face it, diabetes is my specialist subject. Poorly controlled diabetes. Classic. Rowan, so far, kind of very run-of-the-mill. Nothing too interesting here. And by poorly controlled diabetes, I mean Rowan was on 3 separate medications. On 4 medications. One couldn't take one, which was Ozempic. Took the Ozempic, gave them terrible side effects. Couldn't manage it. So on metformin and Januvia and Forxiga, they couldn't tolerate the Ozempic, and so their specialist nurse was saying, if you next stage is insulin, and that was a big deal. Oh my gosh, insulin, that's terrifying. Like, that's it. I'm a failure of a human being because I've not managed my type 2 diabetes with medication and with diet, and now they're telling me insulin, and there was a lot of guilt and shame around this. And they'd had diabetes by this point in time for about 8 years. They're still quite young, but they got it early onset. And as a result, they had a plethora of despicable experiences with nurses and doctors. Horrible ones. Weight shamey ones, diet shamey ones, absolutely no explanation of what is going on, handed a prescription without ever explaining the side effects, the pros, the cons, never given any chance to kind of participate in their own management plan. It's not like, well, here are our options, what do you want to do? It's very much like, this is what we're doing next. So felt very helpless, very powerless, and very much like it was their own fault. That's it. Insulin's starting and that's it. I failed. So they came to see me just because they'd listened to a few videos that I'd done about having diabetes and how stressful that were, and they really connected with that, and they were like, okay, I'm going to book a consultation with Asha and chat it through. And so we start at the very beginning, a very good place to start, and that is tell me about yourself. And so Rowan did tell me about themselves. They told me about their diabetes when it first started, all the different medications, all the side effects of the medications, their most recent HbA1c, their blood pressure, this, that. And there was a lot of kind of, I'm really trying to convince me. I'm really trying, I'm really doing everything I can. A lot of sort of, you could tell they felt really like they had to defend themselves. Constantly having to defend themselves, very vigilant, very hypervigilant, very anxious. And I spent a lot of time going, I'm sure you are, but also let me just remind you that there's very little you can do to control diabetes. It's just one of those things, it's insulin resistance. You don't really get to control that. In fact, the more you try to control it, oftentimes the worse it gets. So, let's just assume that there's nothing you can do about it. Just tell me the story. But there was a big focus on the story, the history of the diabetes. That's I asked Rowan, I was just, and invited them to share anything, and that's where they focused. And I dutifully wrote it all down. Very important stuff. Medical history, of course. I need to know the medical history. And that's often where doctors stop, right? Like, tell me the medical history, tell me the facts of the case. Okay, well, there you go. Diagnosis. I think I talked about this a few episodes ago about, like, how doctors make their diagnosis and how we go through the presenting complaint, because you're all complainers. And then we talk about the history of the presenting complaint, again, because not only are you complainers, but you've got your complainers with a history. Then we talk about past medical history and drug history and investigations. And so I could tell that Rowan was trained in this kind of, like, in this way of doing things, because that's what they presented. Almost like they'd read the form already and were just, like, giving me the answers because they were used to it. And that's all good stuff. Fine. Wrote it all down. Great. Blood results. All right. HbA1c. Fine. A long history of the A1c. It was here and then it was here and it was here and it was here and there and there and then and this. Then 6 months ago this, and I couldn't understand why that happened, and I'm really worried about it. And big focus on the HbA1c, which was telling, because of course my experience of diabetes care is, like, we don't look at you, we look at your numbers. We don't care about what's going on. We don't even ask how you're doing. We just look at your numbers. So yeah, got all of that, Rowan. I took all of that on board, and I was like, cool, now tell me about everything else. And so we spent some time again talking about what life was like in the beginning. Tell me about your childhood. Tell me about your parents. How was life growing up? And as Rowan explored that, I realised that kind of the blaming and the shaming and the guilt was very familiar to Rowan, because it was something they experienced from a very early age. And they were a fat kid with a non-fat parents, but non-fat because they were trying very hard not to be fat. Do you understand what I mean? So it wasn't that they were naturally very thin parents. There was probably, some disordered eating disorders. And so there was a lot of shaming and guilt and blaming, and every time, and growing up, there was a real fear of diabetes. Diabetes was mentioned, not just by parents, not by family members. It was a sort of a thing. And of course, diabetes ran in the family. So, he didn't take care of himself and he ended up with the sugars kind of situation. So poor Rowan grew up experiencing a lot of shame and blame, and also being told if you don't do something about your weight, you're going to develop diabetes. And that was, not a self-fulfilling prophecy. It wasn't. There's nothing to do with your weight. It was going to happen. It was genetic. It was, it was meant to be, but that doesn't matter. That's not what Rowan had heard. Rowan had heard, it's your fault. By the time they got to see a doctor, they were already blaming themselves, first time of diagnosis. And so what the doctors and nurses did for the next decade was reinforce that every time they saw them. Every time they saw Rowan. How's your diet been? Have you had any changes in your diet? Especially because the diabetes was quite well controlled for a while, and then all of a sudden it was poorly controlled. What have you done? Have you had any changes? Immediately, any changes in your diet? Any this, any that, any this? There was no question about, like, what else happened in the last 6 months. Turns out that there was a bout of COVID, followed by sort of post-COVID fatigue, and there was burnout at work. A long history of burnout that just kind of got tipped over the edge after COVID. And there was the breakdown of a relationship, also linked to COVID. So loads have been going on, loads and loads of stuff that would explain this sudden kind of change in diabetic control. But the question was, like, what's happening in your diet? Not as anything stressful happened. And so Jamie's feeling even more. Rowan. It's Rowan. Sorry, this is what's going to happen now. I'm going to get the names confused. Rowan is feeling like it's all their fault. And they don't know that their doctors are wrong. So when the doctor says, oh, well, it's because your diet's changed, or it's because of your weight, like, they assume that's true. They've heard that their whole lives. And now a doctor is saying it. So it must be true if a doctor is saying it. And of course, that's the truth. So when they come to see me, they're convinced that like their diabetes is poorly controlled. It's got something to do with their diet, with the amount of exercise they do, with their weight, and they know that they don't want to do dieting anymore. That they're already involved in the kind of anti-diet space. They've understood that dieting doesn't help, it never works. But what they're supposed to do? They are literally caught between a rock and a hard place. They're being told they're going to need to start insulin and they need to lose weight, and then at the same time they're being told, well, weight loss doesn't work long term and weight loss is harmful, and they know that weight loss doesn't work long term because they've done it many times, and so they're like, well, what do I do? It's too much, it's overwhelming. So they've come to see me kind of feeling like there's no hope, it's desperate times. So they, by the time they'd seen me, they were already making changes, right? So they'd been told they were going to start insulin. A few months later, they came to see me. And in that period of time, they had already started to not try to lose weight, to be fair to Rowan. Didn't try to lose weight, but definitely were quite strict with food rules. So very, very careful about carbohydrates, how much they ate, when they ate, low fat, high protein, feeling quite tired, and also trying to exercise more. And, they were trying to do all sorts of crazy shit that they weren't happy or enjoying, but they were just like, I've got to do this. So, they were like, I'm doing it. And so when Rowan came to see me, they were like, I've been told I have to start insulin. It's because I'm diabetic. It's because I'm, really bad and I haven't been taking care of my health. But don't worry, I've already started doing this and I've already started doing that. And I was like, oh, wow. Okay. All right. I hear you. So, what do we do in this situation? What does Dr. Asher do in this situation? Because I can see the number of people that have failed poor Rowan up until this point in time. And I can also see a very desperate person who is worried about starting insulin and feels they need to act and is doing the best they can. And I, like the part of me that just wants to fix things, wants to come in there and kind of be like, no, do this. But actually, that's not particularly helpful. That's not what they need from me. So the first thing we needed to do is we needed to go back and we needed to explore the very beliefs that were driving their behaviour. And these were not, why do you think you need to eat a certain way? Why have you put these particular food rules in place? Why are you exercising in a way that doesn't make you feel happy? Why? And the answers were very obvious because my doctor told me to, because my parents told me to, because society tells me to, because everybody tells me to. And I was like, of course, I hear you. But let's delve in. And as we talked about in the last episode, I like to look at childhood and family and the family dynamics. I think that's really important. Health experiences. So what have you experienced so far? So we talked about the consultations. We talked about the particularly horrible ones. There's always ones that stick out. And as people start to tell their story, they'll tell a story of a particularly pleasant experience. And as they're telling it, you can see they're almost being transported back. Sometimes I have to say, let's just put a pin in that. We need to exit because I can see they're beginning to feel very unsafe and very activated because it's really stressful. But as Rowan began to explore, why do you think this? And these stories started to come out, and these experiences they'd had with healthcare professionals. Each time we were able to sort of interrogate the statements that were made, the situations, like to reflect upon them, process them. What do we think was actually going on here? What could this have meant? Was this true? How did this make you feel? I don't say that very often because people roll their eyes at me. And also I'm very bad at describing my own feelings. So I get that that's not always an easy question. But we explored all of these things. And as we were doing that, we were challenging these beliefs. We were challenging the belief that Rowan has to exercise in a way that makes them unhappy and has to be very strict about food. And they realised very quickly that they were sort of dropping back into their old eating disorder patterns. I should have mentioned that Rowan has an undiagnosed eating disorder, had an undiagnosed eating disorder prior to entering the anti-diet space, which is very, very common. Sometimes I forget to mention it because, it's hard. I find it hard to find a fat person that hasn't got a history of at least what I would describe as the, eating disorder behaviour. It might not have met the criteria in terms of how long it lasted and all of the different things. But yeah, I'd be like, that's not great. That's definitely disordered eating. So they find themselves back in the disordered eating place, and then they're starting to question, why do I feel like I need to be here? So we're picking things apart slowly but surely. And as we begin to challenge these false beliefs, we can start replacing them with truths, right? Actually, diabetes is not my fault. It's my genetics. Runs in the family. Actually, this sudden change in diabetic control is not because I've done anything. It could be due to a number of things. It could be COVID. It could be stress. Or it could be that diabetes just change over time. We normally find that all of a sudden your requirements increase, your insulin resistance gets worse, and it just happens for lots of reasons, and so that's okay. So maybe there is an obvious reason, maybe there isn't an obvious reason, but it's not a reason that Rowan could control or should or could take responsibility for. It's just one of those things. And so we began to replace all these lies, all this misinformation and disinformation with some truths. And I noticed that Rowan began to be more confident. More like the belief that they deserved better care was becoming more and more obvious. When doctors or nurses said something, Rowan was responding by, "That's not fair. That's not right. I don't deserve that." And I was like, "You do not." Here I am writing notes. "Yes, absolutely. You do not deserve that. Well said." And so on and so forth. And so there was a real sense of kind of, new confidence, putting away those old beliefs, starting to realise that, things weren't as bad as they seemed. And during this process, all of a sudden they stopped being afraid of insulin. They were like, okay, it is what it is. I'm going to be using long-acting insulin, which means I'm not going to have to test my blood sugar very often. It'll be one injection to start with a day. I can handle that. Like, I've had worse. And I've done the injectables. Like, Rowan had already taken the Ozempic, so it wasn't a new thing for them. They knew they could handle that. And instead of being really fearful of the insulin, they begin to think, well, it's what I need. It's what I need to make my body feel well. And so they started taking insulin. And guess what happened? There were two things that I knew were going to happen. And they knew were going to happen. Number one, their blood sugar started coming down, and it was amazing. It was amazing to watch it slowly just going down and down and down. And their doctors were much like, has to be faster, it has to be faster. And Rowan was able to say, no, I mean, it's coming down. At least it's trending in the right direction. It'll get there. I should point out that every time I see a diabetic patient, they're always like, my blood glucose is really, really high. And I'm like, how high? Tell me. And then they tell me, and I'm always like, really? That's the high? Come on now. It's never that high. They always think it's really high. And I'm always like, no, it's not high. I'll tell you what high looks like. Because I've seen high and you don't have it. But, we were watching their blood sugar slowly come down over time. And they were happy. They were confident. They were able to say, I wonder if I need to tweak the dose and go up a little bit. And they were able to say to their doctor, I think I need to tweak the dose and go up a little bit. Rather than waiting for their doctor to say it to them, they were taking control of their own healthcare and saying, do you know what? It's going down, but we sort of hit a plateau. Should we maybe increase the dose a little bit? Doctor said, yes. There we go. Blood sugars kept coming down. It's wonderful. All of a sudden, it's really well controlled. Within a few months, actually, it's quite quick. And everything else was calming down because the liver function was a little bit off all of a sudden, and the blood pressure was a bit high, but blood pressure came down, liver function came down, as one would expect once insulin resistance is better managed. Everything's improving. Which is wonderful, isn't it? What a lovely story. But you know what else happened? Because I said two things were inevitable. One, the blood sugar came down. The second, weight gain. Because insulin causes weight gain. And, we've been telling our diabetic patients, you must be thin, whatever you do, you must be thin. But then when we give them insulin, we're like, oh, this is going to make you fat. And doctors will still tell you off. Doctors will still tell you off for being fat, even though you're on a medication that is going to make you fat. Like, insulin is it's notorious for weight gain. So these two things happened. And I was a little bit worried. I was a bit worried about Rowan, I'll be honest, because I wondered if that weight gain might trigger eating disordered behaviour or beliefs. I wondered if it was going to make, lead to some medical avoidance. That was one of the things I worried about, because obviously I'm not Rowan's doctor and I'm not there to manage their diabetes. And so they need to be under a specialist. or actually in this case it was primary care, but still they need to be under the care of a doctor, a real doctor. I am a real doctor, sorry, just to clarify. Definitely am. A lot of people don't think I am. I am a real doctor, but I mean like their own physician, that's what I meant. So I was worried as the weight went up that Rowan was going to struggle, but actually, of course, they, proved me wrong. I was very happy to be proven wrong, because what I noticed was that as we began to challenge these beliefs, as the confidence grew and the belief, actually, I deserve better, so too did their kind of self-worth, especially when it came to weight and sickness, because specifically, especially when it came to their weight and their health, for want of a better word, I began to see real positive changes, real positive growth. They stopped blaming and shaming themselves. And we all fall into those patterns. There was always I still wonder whether I should try a weight loss. But then I think to myself, no, I'm doing the right thing. So they were able to sort of express that fear, but at the same time, speak to that fear. They were able to really kind of, what's the word I'm looking for? I'm trying to visualize all my different clients now as I've turned them into Rowan. I watch them blossom. That's a bit corny. But before my very eyes, and it is my favourite thing in the whole wide world. There's nothing I love more than this. It is my, literally, I look forward to working one-to-one with clients to see this happen. To just see the moment where they catch themselves in the middle of a kind of sort of, whatever, putting themselves down or whatever, and they catch themselves and they go, no, actually, no, it's not me, it's them. And my heart soars. So, yeah, Rowan gained weight and that wasn't pleasant, and clothing size went up, and there was always going to be an incident where they don't want to be weighed, and so we obviously, most of my clients refuse weights, but we need to weigh you for your insulin requirements. That's one of the things, is you'll need to be weighed. And okay, fine, if you're going to weigh me, we discussed this before they went for their first appointment. If you're going to weigh me, that's fine, but you can't tell me my weight, and you absolutely can't discuss my weight with me. It's just you're doing that for insulin. I get that, but of course, it ends up on the record, and then when they go online to see their notes, it's up there, and BMI equals, it's automatically calculated, and it's horrible. And so, there were wobbles. There's always a wobble, and a wobble is fine. It's all right if you're having a wobble. But as time wore on, they were better able to manage those wobbles on their own. And that's my favourite part, because then I'm like, well, farewell. It's been a pleasure knowing you, but you don't need me anymore. You can do this on your own. I don't kick them out. We come to the end of our sessions. I usually find, you may be shocked to hear this, but it usually takes 6 sessions. 6 doesn't usually take longer than that. I've done 12 sessions with a couple of clients, but usually 6 is enough. And it's remarkable watching people change over those 6 sessions. Usually we do the 6 sessions over a period of 3 months. It can be longer, but I find that that's the best. That is best if we're seeing each other once every 2 weeks or so for 6 sessions. And the first session is just a getting to know you session, and the second session is often a wrap up, and there were all these things we've forgotten. Let's mention those, and then focusing on the kind of main issues at hand. And then sessions for 3 and 4 and possibly 5 are really picking away at things. And as I say, the growth is happening with each session. The growth is happening. Things are changing. Beliefs are being challenged. Truths are being accepted. Attitudes are changing. And then we get to the 6th session. We're right, let's do a summary, shall we? And we kind of debrief, as it were. And usually that's enough. When I start sessions with a client for the first time, one of the first questions I ask before we start anything else, before we get into the details and get bogged down with the details, I like to ask, so I want you to imagine yourself at the end of our sessions. What is it you'd like to get out of this? I want you to imagine yourself, future you. What does future you look like? What does future you feel like? And so Rowan wrote, no guilt, stop blaming myself, not afraid of going to the doctor, not afraid of having a blood test. What else? Rowan wrote, blood sugar controlled, better controlled. So better diabetic control. Work on body issues. and advocate for myself at the doctor's office. Better able to advocate for myself at the doctor's office. So those were the kind of like future self. And it's really delightful when we get to the end of our 6 sessions, when we can look back and go, well, look at that. You did that. Mate, you did that. Rowan, you did that. Like, I was just there to I was there. I came along for the ride, but you did it. And it's wonderful, because really, honestly, people do it. My clients don't think they can, but they can. And that doesn't, again, it's not a happily ever after situation, because doctors will remain shitty. I hate to tell you this, but once an arsehole, always an arsehole. And a leopard doesn't change their spots and all that jazz. Like, they are, no matter how hard we try, we're not going to persuade them to be nice people. And I'm going to do the blaming and the shaming and the fear mongering and the you're going to die in 5 years and all that jazz. And once you start challenging all of those beliefs, once you start to be able to spot it, to recognize it, to challenge it, to ask what else might be true, and how am I feeling in this situation, and do I need to react to this situation? Do I need to actually listen to what my doctor says, or can I afford to ask questions and challenge these things? And so slowly, as I begin to do that, like that level of confidence, or that sort of transformation, like, seems to just, it takes over lots of different areas of their life, actually. And then, they don't need me anymore. Life isn't perfect, but Rowan and people like Rowan feel better able to meet those challenges, knowing that they have the tools to be able to say, do you know what? Whatever you throw my way, I'll be able to handle it. Now, obviously, I'm always around. Like, I'm not like, you can come back and see me. And maybe one day Rowan will. Rowan is a fictional character, so they won't. But, people like Rowan might. But I have a feeling that they won't need to. And I like that. I am not looking for clients that sort of depend on me. That's the last thing I want. I want my clients not to depend on me. That's why I like to say 6 sessions. It's not like very black and white. We might need 7, but I like to say 6 so that we have an end in mind. We have an end in sight. There's a goal, there's a plan. And so usually we get to the end, and most of the time, we've got there. And it's great. It's delightful. I hope you like Rowan's story. I think a lot of people who follow me are diabetic. And so this might be you. You might be hearing that, listening to me and going, it's like you read my mind. Well, you know where to find me. I'm not being funny, but if you like the sound of that, it could be you. You could be Rowan. You could be the next Rowan. Oh dear. I need a break. I need to rest my brain, clearly. But yeah. Hope you enjoyed this episode. I didn't pick a name again. Damn it. I'm gonna look at my list of names. I'll be with you in a second. Phoenix is next. Next week is Phoenix's story.